In this video, we'll look at the case management features in MedFiller. Forms such as the DOT physical are often the entire reason for a patient visit. However, occupational health visits can often involve many different and sometimes related forms, including employer authorizations, consent forms, HIPAA information release waivers, general pre-employment physicals, additional exams and testing based on the job description, case conclusion letters, and even invoices to the employer for services rendered. A case in MedFiller is simply a collection of any number of these forms grouped together to address the needs of a complete occupational health visit. You can mark forms as required or optional and even choose which pages of which forms are relayed back to an employer when the case is completed. To start a case, select an employer and enter the patient's email address. MedFiller automatically sends all forms that require patient input directly to the patient. You can then track and monitor overall case progress and see which forms and services have been completed in MedFiller and which have pending issues, such as a wait for test results condition. Sequencing rules allow you to ensure that forms and associated services are rendered in your specified priority. For example, you can ensure that consent and HIPAA waivers for information released to employers are always collected before any other form is completed. If you need to put a case on hold, notes can be associated with individual forms or the case as a whole. This allows your team to be easily aware of the situation when the patient returns. This is especially useful if a different team is working when the patient returns. Most importantly, you can bring any custom fillable PDF form into MedFiller and make it part of your cases. This allows you to electronically return results and information to the employer how they want it, without ever resorting to paper forms and scanning them back into your EMR. Call or email us today to schedule a demo of case management features in MedFiller.